flash floods in Brazil. You know what I mean?
Yeah.
When you hear flash floods, like all of a sudden like a mountain just falls, this is the reason why. It goes from a dry state to a rapidly oversaturated state. Look, look, it's already clogged with water, right?
Yeah.
The water cannot move fast enough through the mountain, so the earth gets overly saturated and it's super heavy. See how it's gonna get all flooded? So the manholes don't have enough time to process all this water, so literally you have floods. This is flooding. Yeah, like the water is bottlenecking. This is flood rain.
Hi, we're going to see Junior.
It's like God has a big water hose and he just turns it on and like spraying on us.
Local news has you covered. Reopening has begun.
Our team of experienced reporters brings you Edmonton's most complete coverage. We are here on scene investigating.
Informed with Edmonton's #1 local news. Local News Hour at
There's
6.
White Ave.
Welcome to the move-in ready community of Makana.
I'm sure you guys you're familiar with the whole situation.
Yeah.
There's been an awful lot of ultrasounds we've done and checking the left side of the heart. So I'm trying to figure out what exactly we need to do. That's okay. And basically the conclusion is that it looks like the aortic valve and mitral valve are probably big enough size. And the left side of the pumping chamber is big enough size. But the aortic arch, so that's the part of the aorta that comes up and around this way,
Thank you, Aaron.
is still quite small. And that's even with the prostaglandin still running. So it'll probably get a little bit smaller once it comes off. So the conclusion is that that's what needs to be addressed, and the rest of it should probably be okay. So what we're planning to do tomorrow is fix the aortic arch. So to basically provide unobstructed blood flow from the left side of the pumping chamber to the rest of the body. And that will take the stress off the heart as well, because you want to squeeze some blood to get that blood flow through there. And hopefully that'll be all we need to start on. Now, it may be that the heart isn't, or the rest of the structure isn't good enough enough, and that we need to think about other strategies. I think the likelihood of that is quite low.
Okay. It's looking good.
Like less than 5% chance of having to do something else.
So like, are you talking about single ventricle?
Exactly. Or something.
No.
So, like I say, based on how things are looking right now, the anatomy, right now the left side of the heart is taking a full cardiac output because there is no, there are no septal defects, so there's no mixing of blood between the two sides. So all the blood that comes back from the lungs is going to the left side of the heart.
So it's working as a regular heart.
Exactly. Right now
Okay.
it's doing full cardiac.
If there was a septal defect, it would make things a bit more.
Exactly.
We wouldn't have a baseline, right? To know exactly how it's working.
We wouldn't, that's right, we wouldn't really kind of have an idea of how much work it's actually doing relative to the rest of the heart.
And then,
But right now it's just pumping to the, mostly to the head and neck because that arch being so small and the coagulation.
right.
So most of that blood is going just to the head and neck, and the right side of the heart is pumping to the lower leg. But it's still, like I say, it's receiving all the blood that's coming from the lungs. So it's still pumping it forward. So basically, in order to do this, what I have to do is I have to go through the front here to get access to the heart, put it onto the heart lung machine, cool the body down enough to be able to slow the circulation to repair that arch, because obviously I can't work on when there's blood flow going through it. But I won't have to stop the circulation completely. I'll keep perfusing his brain continuously.
What do you mean, sorry?
Sorry?
What?
Perfusing his brain.
Providing
his upper
blood.
body. Providing blood to his upper body throughout the operation. So there's no period where his circulation will be completely stopped. And then basically get him off the heart lung machine. We'll have to look at how things look at the end. Sometimes, because it's a fairly big operation, the heart gets a bit swollen, and we can't close the chest completely at the end. We just want to close the skin. That's kind of a judgment call in the operating room.
Based on how it goes and towards the end.
Exactly. How much medication he's needing to support his heart and blood pressure and that kind of thing. And then, of course, how he responds to trying to close it. If things deteriorate, then we have to just leave it open. Typically for a day or two. And then just in the intensive period, I can take the skin incision down.
And
Close the breastbone and finish off that.
So like the bone would remain open and then
Just the skin goes on top.
the skin closed, but then at some point you'd have to be reopened and
Yeah, that's only in the back.
And that's a worst case
Oh,
scenario.
wow.
In case the heart starts
Yeah.
swelling, they'll know by the end based on the
is that like
levels.
how likely does that happen? Or is it pretty likely?
So
or?
if he were to go down the single ventricle pathway with an Norwood, we do it routinely.
Yeah, it's not a procedure.
Let's hope
So
that's
this
not
is-
what he needs.
Yeah, so this, exactly, we're not anticipating that he's gonna need quite that big of an operation. And that because the two chambers should be pumping okay at the end,
Yeah, I just need one more.
his heart should be able to function all right. I would say maybe there's about a 20% chance that would leave his breast.
Like I said, if it does happen, it's not a big deal.
It's not a big deal, you
Yeah,
just go back in
it's
the
fine.
next day.
It's better they do that than that they don't do that
Yeah,
and it's hard
exactly.
swelling.
And then he
Yeah,
struggles.
totally. And then like, so there's like, I guess, different types of arch repair, and I was wondering which type he's going to be getting.
So there's basically, you can think about it really only in two ways. The first way is that we can do it through the side without putting him onto the heart-lung machine. And that is really not an option for him because
Yeah.
his arch is small the entire way around. And then the second way is to do it through the front using the heart-lung machine. Cooling his body down so it can slow the circulation to fix the arch. And then putting him back on full support with the heart-lung machine, rewarming him, getting him off the heart-lung machine.
I
So
think-
like
I think
end to
what you mean
end
is
or
more
like-
like inside on the patch itself. What type of a patch?
Like there's
it's
like
gonna
an
be.
end to side, or like I was just reading about it, there's different kinds.
Oh,
Like,
yeah, there's, okay. There's lots of different ways that I can stitch it together.
Right.
There's-
Yeah.
Yeah.
there's like
So-
subclavian flap or something, and
Yeah, that's for when you do it through the side.
Oh,
That's-
okay.
That has nothing to do with going through the front. So going through the front always involves a patch.
Yeah.
a patch, yeah.
Of some kind, patch material. And what we'll use is bovine pericardium, it's called. It's the sac around the heart from the cow.
Oh, okay.
It's
Oh.
been tanned in a certain way to render it inert. And it's very good patch material. We use it for all kinds of things.
Okay, so it won't be his own other heart material from
There will be
himself.
other material that we use in addition to his own.
I just have to
Right.
And that lasts for, it can last for a long time, or what's the?
Yeah, so that material itself,
5 mils.
what typically happens to it over the long run is it gets calcium buildup in it.
Right.
And it can get quite rigid.
Yeah. Yeah.
And occasionally there's like scar tissue that forms around repair sites, or the arch itself doesn't grow the way that it's supposed to with the rest of them.
Right.
So it effectively over time becomes narrowed again because it's not growing the way it's supposed to. So there's probably sometime in the next 5 years, 10 years, about a 20% chance of having to go back in and do something else.
Right.
Typically that can be done with a balloon.
Mhm.
So sticking a catheter in his leg in the artery, putting it up to that site, putting a balloon in there and stretching it,
Yeah.
and that's all.
And that's around 20% chance.
Yeah.
Okay.
Yeah,
But
so it's
then-
not 100% chance, but it is,
Yeah.
20% chance
Yeah,
is
it's
still pretty
still
high.
high,
Like 1 in
yeah.
5, yeah, that's still a pretty high chance of needing
But there's no way to use it. He's only
Yes.
for the operation. It's not an impression. Hey, Mama, you gave him Junior his last feed before surgery.
Yep.
Yeah.
Bright and early, 7 in the morning, he's going for surgery.
That's right. We gotta be here 5 in the morning tomorrow. Spend lots of time with him. Yeah.
Little guy.
He's going at it. Got milk. Mama got milk.
Good boy.
There he is. Happy as ever. Pretty Sunday.
Yeah, from that angle, it's
Straight
be a
from
bit
the
nicer
source.
angle over there. There you are. Good boy.
Okay.
There he is.
Hello.
Hi.
Oh, you didn't take this too, eh?
No, not yet, I guess.
It could potentially be his last feed before surgery. From Mama.
Oh, yeah. I'll just leave that there for the time being and let you enjoy.
Thank you.
There he is, Mama. They won't get to feed him again for a while.
Yeah. Poor little guy. Surgery's gonna go well. God's gonna be there with little Julius. If that's what we call him. Right? Jesus is gonna be with you. in surgery.
Wait, stop filming?
It's mommy. Oh my goodness, cutie. You're so cute. What a good big boy. Yeah. Yeah. Who's that, Julius?
Look at those eyebrows.
I know, like frowning. Hi. Can you smile for us again? Can you smile for us again?
She was 36 for last.
Hi, baby. Julius. Do you like Julius? Julius is a cool name.
Mother.
It's from you.
Oh yeah, I'm the one who
Definitely.
does like front end and look at things. Think about it.
Those
Who
are
does
your
things a lot?
eyebrows.
Who does this? Huh? Huh?
That's you.
It's 100% mother frown.
What's with his hand on his face?
Yeah, I need to count. For fingers.
Hi.
It's
Good
like doing the Spider-Man
boy.
thing. Hi, buddy.
Are you Spider-Man? Julius. Hey. He seems like a normal baby right now. Like, I mean, like more interactive. Just, like more aware. Did you capture the chin quiver? Good. The chin quiver. Yeah. Good baby boy. Who's a good baby boy? You're so cute. Do his ears stick out a bit?
No.
Look.
No, it's just the way you've been squeezing them.
Good boy. Cute little baby sound you're making.
My name is Junior.
I'm a baby. I'm a baby. Who's a baby? Who's a baby? You're so cute. You're so cute. Yeah. You have a really big day tomorrow, right? Yeah, you're gonna do great. You're gonna do great, yeah. Are you getting sleepy? Are you getting sleepy, little guy? Oh my goodness. Oh my goodness. Hi. Hi. Who just had some milk? Did you just smell your armpit? Hi, baby boy. Yeah. It's a really big day tomorrow. You're gonna do so good. Yeah. I think he has a little blister on his lip. Does it? Do you see it? He's got like flaky. Hi. Do you have blue eyes? Do you have blue eyes? Do you have blue eyes?
Keep saying it. Saying it.
Oh my goodness, do you have blue eyes?
Just say the blue eyes part. That's
Blue eyes?
keep saying it.
Blue eyes? Hi, blue eyes. Do you have blue eyes? I can't see his eyes now. He's sleeping. No. You're so cute and little. You're a baby. Are you a baby? Are you a little baby?